Biopsychosocial assessment, James case study. Assessment tools for the client. A biopsychosocial approach is a holistic way of treating sexual disorders, which involves a multipurpose awareness of sexuality. In its sense, both sexual and perceived sexual and fundamental sexual functions can be influenced by physical, neurological, neurocognitive, behavioral, and relational factors. Several factors, including decreased self-esteem, lowered self-confidence, and impaired capacity for sex and intimacy, can potentially influence gender and sexual function. For instance, the clinical interview would help gather essential data from James. Clinical questioning is a different way of interviewing, involving an appointment between a healthcare professional and a client, both face-to-face, to collect information required for client management and therapy. In-depth data on a customer is provided by interview sessions but is restricted due to the reliance on a clinical judgment susceptible to individual prejudices. Additionally, an unstructured instrument that involves clinical assessment to ascertain the client's subjective experience is a way of collecting the required information. Alternatively, psychometrically sound equipment such as in-depth questionnaires and standardized tests will make it easier for the counselor to make rational inferences about James' sexuality and biopsychosocial issues threatening his family. Conceptualizing with a specific theory. James' case study acknowledges the distinct principles of psychodynamic theory. The psychodynamic model is essentially a combination of theoretical frameworks that extol the virtues of drives and many other forces, mainly unconscious drives in human cognition. This framework is the foundation for adult personalities and relationships, according to children's experiences. The psychodynamic theory has its origins in Freud's psychoanalytical theories, including the ones introduced by Erik Erikson, Anna Freud, and Carl Jung. All of his ideas are included in the framework. Historically, the role of instincts as sexuality in psychology has diverged from an early concentration of focusing on the operations of self-image to the specific interest in the mother-to-child dyad and its long-term impact on interpersonal relations and its internal representations. In the meantime, the psychology of individuality is becoming a part of so many psychoanalytic concepts. It has become a clinical theory in which etiology and its therapy are viewed as mentally represented. Specifically, James' life experiences played a crucial role in defining the kind of life he lived. For instance, being an adult child of a drunk father who did not have time for his family, James spent most time alone watching porn. James negatively viewed his father and his role in shaping who he developed into. As a result, the client had added over 50 pounds in 2 years because of his inactive kind of lifestyle. During his time, James watched porn videos regularly despite having a wife. Controversially, James confesses a lack of interest in engaging with his wife sexually, citing his wife's changed behaviors after the birth of their second-born son. Instead, he is only aroused when watching pornographic materials threatening their intimate relationship with his wife. With his son being 2 years old, it is correct to assume that he added weight because of his irresponsibility and sedentary lifestyle. Comparison with system and CBT perspectives. The conceptualization of James' case based on the principles of the psychodynamic model varies between the systems and CBT perspectives. The system perspective generally considers the family as a unit of self-regulation linked by unspeakable rules designed to preserve themselves. In dysfunctional families, psychological signs are considered, but the main emphasis is on the family's scheme, not on the issue or the symptoms. For instance, James' unresolved family issues might be the cause of his controversial sexual behaviors threatening his marriage. His perception that his father disregarded his life might have influenced his current behaviors. Consequently, James ends up leading an irresponsible kind of life that threatens his marriage. On the other hand, if proof of family dynamics exists, structural family counseling is suitable. A strong link between a child's issues and family breakdown should be noticeable. Families have only a bare minimum of coping skills. However, they are not solid contenders for treating families. Cognitive behavioral therapy, CBT, is a type of speech therapy that can help people with various psychiatric issues. CBT is based on the idea of how people's thoughts, emotions, and thoughts behave. the opinions of society specifically influence one's feelings and behavior. James' intrinsic values resulted from how they reacted to his experiences during his childhood period. Incorporating sexuality positivity. Conceptualizing James' case will help incorporate a positive sexuality perspective. Using the various theoretical models to explain James' case will enable the audiences to acknowledge the complex nature of sexuality and family togetherness. The objective of the comprehensive system for sexual training is to promote sexual health. Another statement that needs to be made in this scheme is that intercourse is just a tiny component of human sexual identity. The need for health professionals to shift from sexuality-based models based on pathology to sex-positive designs that help activate well-being has been identified by professionals from numerous perspectives. Sexual positivity is the term for people and groups who accentuate openness, non-judgmentalism, autonomy, and sexuality. Thus, sex-positive counseling systems claim that sexuality is an essential aspect of counseling that mental health practitioners often overlook or deliberately ignore. Treatment goals derived from the positive sexuality perspective. A sex therapist aims to help people overcome physical and emotional problems to have satisfying relationships. A positive sexual attitude integrates the positive and nourishing facets of sexual activity and sexuality in physical, autonomic, passionate, erudite, spiritual, and social terms. Even though health includes gender positivity, the notion of sexual well-being has expanded to include several biological, cognitive, social, and mental elements of an individual's performance. It offers a powder-filled tool for consulting psychologists to create a series of studies of sexuality between the poles of full sex negativity and complete sex positivity. This sexuality perspective aims to develop a positive attitude about sex. Many members of society blame their cultural identity for fostering an assault on sex and sexuality. Some criticize the oversimplified advice for adolescents to refrain from sexual activities. Many experts also argue that society's measures to avoid pregnancy and infection involve incidental sexual negativity. In this sense, sex is discussed more frequently than healthy gratification and rational openness. A sexual act has less to do with applying schema therapy to sex research, training, and practices but rather about transforming how psychotherapists in the therapy sector have learned about sex as a whole. Thus, the treatment goals are intended to enhance sex positivity and also promote the well-being of society members.